All right, let's just jump right in. We think of getting sick as a fight for our health, right? But here in the US, it can kick off a whole other battle, a fight for your financial life. Today, we're going to break down why medical debt isn't just about the money. It's way, way bigger than that. It's a public health crisis.
And this right here, this just hits the nail on the head. Imagine that. You have a health scare, you get the care you need, and bam. Suddenly, you're in a financial nightmare. A surgery that saves your life shouldn't also trap you in debt for years. But for millions, that's exactly what's happening. And that cycle, it can just pull the rug out from under an entire family.
And look, this isn't some small, fringe problem. The scale of this is, honestly, it's just staggering. 100 million. That's the number. 100 million adults in the US are dealing with medical or dental debt. I mean, just let that number sit with you for a second. So the big question is, how did we even get to this point? Let's peel back the layers and look at the actual numbers. Because when you do, you realize this isn't just some random problem. It's a full-on epidemic, and it's tangled up in the very DNA of our healthcare system. Okay, so that huge number, 100 million, what does that actually look like? Well, this chart puts it into perspective. 41%. 41% of adults in the US are carrying some kind of medical debt. That's almost 2 out of every 5 people you meet. It's huge. And here's where it gets even trickier. This debt doesn't just stay in one place. It's not just a bill from the hospital sitting on your kitchen table. Nope. People are putting it on credit cards, taking out loans, and then, of course, the collection agencies start calling. The debt, it's like it spreads, kind of like a virus, and infects every single corner of your financial world. And it's really important to see who's carrying the heaviest load here, because it's not an equal burden. Just like with a lot of public health crises, it hits already vulnerable communities the hardest. We're talking about Black and Hispanic households, low-income families, women, people without insurance. They're all facing way higher rates of medical debt. And all that does is make existing inequalities even worse. Okay, so this is really the heart of the matter, the main takeaway. This is not just a financial issue, not at all. Medical debt has a very real, very direct, and very negative effect on our actual health, both physical and mental. And this is the impossible choice that millions of Americans are stuck with. It's a real catch-22. Do I get the care I need and maybe go bankrupt? Or do I skip the doctor to keep a roof over my head? I mean, come on. That's a brutal choice that nobody should ever have to face. And you can see the ripple effect of that impossible choice right here in this chart. Look at this. So about a third of all adults put off care because of the cost. But for people who already have medical debt, that number just explodes, 64%. We're talking nearly 2/3 of them are putting off needed medical care. The pressure is just immense. And what happens next is, well, it's predictable and it's tragic. You skip a checkup, you postpone a surgery, you try to make your prescription last longer. And things that were manageable suddenly aren't. Chronic diseases get worse, people get sicker. That debt cycle is literally making our population less healthy. And look, this isn't just a gut feeling or a few sad stories. There's hard data to back this up. A big study from 2024 basically connected the dots for us. Here's the bottom line from their findings. In counties with more medical debt, people had more days of poor physical health, more days of poor mental health, and get this, higher death rates. There's a direct link between debt and how long you live. Yeah, there's actually a name for this. It's called financial toxicity, and it's a powerful idea. It basically says that the cost of your medical care can become its own kind of sickness. All that stress, all that anxiety, all those terrible choices, it's like a second illness piled on top of the first one. Okay, so we've established the problem is huge, it's damaging, it's a mess. But it's not hopeless. So let's shift gears now. What can we actually do about it? Let's talk about some real solutions that are actually happening out there. With things often getting stuck at the federal level, some states are just saying, we're not going to wait. They're stepping up and taking action themselves. And they're proving that you can make a real tangible difference at the state level. Let's look at Michigan. This is a great example. The state teamed up with a nonprofit and just wiped out $144 million in medical debt. Just gone for more than 200,000 people. And the best part? It was automatic for folks who qualified. No crazy paperwork. It's just a fantastic example of how getting rid of debt is itself a form of healthcare. But, making policy is a tough game. It can be one step forward, two steps back. For example, there was this big federal proposal to get medical debt completely off of credit reports. A total game changer, right? But then, a court struck it down. It just goes to show you that even when we have a good idea, getting it to stick is another battle entirely.
So what we're left with is kind of a patchwork quilt of solutions. You've got some good things happening, for sure. Medicaid expansion helps. The No Surprises Act is great for preventing some of those shock bills. And a few states, like Colorado and New York, have gotten medical debt off credit reports. But then you have the rise of these high-deductible insurance plans, which still leave so many people completely exposed. It's an uneven fix.
And all of this really points to a bigger idea, a fundamental shift in how we think about this. Because at the end of the day, we can't just be cleaning up the mess after it's made. The real solution has got to be about stopping the debt from ever happening to begin with.
So, what does that actually look like, prevention? Well, it's not just one thing. It's got to happen on multiple levels. First, hospitals need to be proactive, right? They should be automatically checking if patients qualify for financial help before the bill goes to collections. Then, you've got places like universities that can help teach young adults how to navigate this super confusing system. And the big one, the most important one, is that policymakers have to start seeing financial protection as a basic part of public health, just as important as having clean water to drink. So, that's the question we're all left with, isn't it? This isn't about making a few small fixes here and there. This is about reimagining whole thing from the ground up. How do we build a system where getting healthy doesn't mean going broke? Because really, the decisions we make today, the policies we pass, the systems we decide to create, that's what's going to decide if our kids and grandkids have to deal with the same broken reality. We have to remember this. When getting sick comes with a giant bill, you can never really truly recover. And it's up to all of us to change that story.